Good evening. My name is Stacy McCrory, and I'm a nurse practitioner student at Auburn University, and I am going to be doing a suture demo video for you this evening. So a few important things you need to go over with your patient before you begin is you need to ask them about their allergies, if they're allergic to any anesthetics, antibiotics, latex, things like that. You want to ask them their medical history as far as if they have diabetes, HIV, and then also ask them about their tetanus status, because according to the CDC, if you have not received one within 5 years, you should get one before the end of the visit. That should be addressed. You also want to ask them about the mechanism of injury, how long ago the injury took place, and according to the AAFP, you can actually suture uncontaminated infected wounds up to 18 hours after injury and even up to 24 hours if it's on the face. So that's very important. A few things to gather before you start your suture and your lac repair is you want to get your irrigation supplies. So you want to irrigate the wound, make sure if there is any debris or foreign bodies like glass, things like that, you get those out before you close it. And you can actually use normal saline, you can use sterile water, and you can even use tap water. But you should try to stay away from betadine and iodine because they can impede in the wound healing process. So you have your irrigation supplies. Now you need to get your anesthetic. So there are a few options. If you have a child, you can always, and if time allows it, you can use a LETS. We call it LETS because it stands for like lidocaine epinephrine topical solution. And what you do is you can put that on a cotton ball and put that over the wound, hold it down with some Tegaderm, and that actually hopefully numbs up the skin so that once you are going in with the other lidocaine, that will be a little less painful and traumatic for the child. But for adults, you can use the LET for adults, but you want to go with a lidocaine. So you have lidocaine 1% and lidocaine 2%, with and without epi. So you just have to remember the big difference is how much you can give the patient, because with 2%, you can't give as much volume as the 1%. And you can use epi. So epi is a vasoconstrictor. It will help control the bleeding, but you should not use it on 5 important places on the body. And that is going to be the toes, the penis, the nose, the fingers, and the earlobes. And you also don't really want to use it when you are having to go circumferentially, like around for like a digital block. So you have your anesthetic, you have your irrigation, now you need your sutures and your other instruments from a lac tray. So you want to use a needle driver, and you can use forceps, and then you'll also need some scissors. So when choosing a suture, you want to use the smallest suture in order to get it fixed. So basically the smaller the suture number, the larger it is, the larger the thread. So for your trunk, you can use a 3/0 or a 4/0. For your extremities and your scalp, you can use a 4/0 to 5/0. And then for your face, you want to use a smaller thread, so you can use a 5/0 or a 6/0. And there are absorbable and non-absorbable sutures. Your absorbable ones are used for deeper layers so that you don't have to open them back up and remove them. But for simple repairs, you would go with a non-absorbable, so like a Proline, or nylon. Those work really well with the skin. So today I am going to be using a Proline, and it's going to be a 4.0. So we've irrigated it. First of all, you want to make sure you wash your hands properly before you do anything. And now you don't specifically have to use sterile gloves, because there was a study that showed no increased risk of infection if you were to use clean gloves versus sterile gloves. So make sure you have on gloves. Numb up the area with your anesthetic, and then we're going to begin our repair. So I'm left-handed. I'm going to take my needle driver in my left hand with my suture, and we're going to be suturing this laceration right here. And so you want to go at a perpendicular angle, about 90 degrees. Go in and pull through. And you want to make sure you get the laceration well approximated, so you don't want your sutures too close together. You don't want them far apart. You want them equally spaced, just enough to close the wound. And so you're going to take your suture, your needle driver, and it helps if you hold it perpendicular over the laceration. Pull it to one side. Pull your knots to one side. You don't want your knots directly over your wound, and pull them in opposite directions, and then come back around. And so this is a good time that you can go over with the patient about post-laceration repair care. You want to make sure they keep it dry and covered for the first 24 hours. That is a recommendation by Up to Date. And then after that, they can take the dressing off and clean it with a mild soap. Stay away from detergent, like high perfumed soaps and detergents. You want to make sure you do at least 4 throws. You can throw in a couple more just so that you have a good knot, and then you hold your scissors kind of slanted and cut. And then you start over, and these are simple interrupted because you are cutting them and starting back over. They're not just one long suture. So also you want to talk to them about signs of infection, what to look out for. So of course, any redness, swelling, drainage, fever, and the good thing is if you mess up, you can always just pull it out and start it back over. So also go over with the patient when they need to return for the sutures to come out, and that's going to depend on where the suture is at on their body, because the longer the suture stays, the higher their risk for, well, the more they're going to scar. So if it's on the face, you want them to come back within 3 to 5 days. If it's on the scalp, You can wait 7 to 10 for the arms. The trunk is 10 to 14, excuse me, as well as the legs and the hands and the feet. Now, if it's the palms of the hands or the soles of the feet, they need to stay on there a little bit longer, so they'll come off in 14 to 21 days. But now prophylactic antibiotics in healthy, uncomplicated laceration repairs is not indicated. But if you have a laceration that you end up doing like an animal bite or a human bite, an intraoral laceration, like a nail bed laceration, then those may need antibiotics. They can use after 24 hours, you can use like the mild soap and water and rinse it off, and then put some bacitracin, or you can even use Vaseline over the wound, and then leave it open to air. Got our one throw, look back around, second throw, 3, 4, and 5. Okay, and one more. And of course, I'd have on gloves during this. One more. Okay, so all of our knots are on one side. Cut the final string. Make sure you put your sharps in the sharp bin. We're gonna enclose so it's nice and close. They're evenly spaced. And so we've gone over our post-repair care at home. So after you have repaired the laceration, you can put a non-occlusive dressing over it and just readdress if they need a tetanus before they leave, and also tell them to avoid soaking the area, especially for the first 24 hours. They need to keep it covered and dry. And so I hope you've enjoyed the video and you learned a little something. If you have any questions, let me know. Thank you.